Hello, welcome to this lecture for the Chrysalis Diploma in Counselling Skills and Theory. This is component 5, Relationships, Bereavement and Loss. And this is module 6, Relationships. You can find the standards met by this particular component outlined in Moodle and in your written course materials. I will share some slides with you throughout this lecture, and you'll be able to view and download these slides from Moodle if you wish. Please note any questions that you might have as you're watching this lecture, and take these questions to class to discuss with your class tutor. Hi there. So today we're looking at relationships. Now, we all need relationships. They ensure our procreation and therefore our survival. And as an individual, relationships help to support our self-esteem and our work performance, and also sustain our mental health. No one can survive without relationships. A lot of people do prefer living a more isolated life, but even they need contact with other people to get their food, to be able to survive. So what is a relationship? The way in which two or more people or things are connected, or the state of being connected, the way in which two or more people or groups regard and behave towards each other. Definition 2, an emotional attachment and sexual association between two people. So here we're looking at relationships in general and also an intimate relationship. Now, we live in a society and we have relationships with all sorts of people. We have friends and family, we have neighbours, we might know our local shopkeeper and people around our area. We have acquaintances. Really, anyone we mix with in society can be seen as a relationship. And as humans, it helps our survival when we're in groups, family groups, community groups. Now, as a baby, we depend on a nurturing figure for our survival. And we need that care and nurturing. And hopefully, if we get that, then we will continue to make good relationships in the future. We believe that people are good, life is good, and we'll find it fairly easy to make friends. But if we don't receive that early nurturing and we feel insecure, then that feeling of love is something we won't understand. It will elude us. And we're always trying to find that thing that we haven't had. But because we haven't really experienced it, we don't know when we've found it. And sometimes if we do find it, we can push it away. So future relationships can be a challenge for somebody that hasn't had that early nurturing. That first relationship with our mother or our primary caregiver should be one of complete trust and total dependence. And then when we start to form other relationships, we do expect other people to have the same perception of the world as we do. And of course, this is where relationships can go wrong. because everyone that we have relationships with has got their own unique view of the world based on their past experience. One of the other problems with relationships is that we all change as we go through life, but people don't always change in the same way. And so friends can drift away. We might realize that our partner no longer wants the same thing as us. And this can cause conflicts and fear and anxiety, insecurity, guilt and jealousy. So let's first of all look at some tools that can really help us when we're working with volunteers and later on with clients. So this is a relationship circle diagram, and it's very simple and easy to complete with somebody. So we have that inner heart is me, and then there's circles going around, going further out, that can represent other people in your life. Now, there's a copy of this in your module notes, and it can be used to find out the significant people in someone's life, and it can be used in different ways. So, for example, it could be based on how important each person is to you, how the relationship affects your self-esteem, how each relationship affects your anger or stress, how supported you feel by that relationship, or how much excitement or satisfaction you get from the relationship. And if you don't give any explanation to clients on how to do it, they might do it in any of those ways. Some people will only put family and close friends into the diagram. Others will put in a wider range of people. Now, some will include their pets, and some people include loved ones that have died, because even though they're deceased, they still feel close to them. And that's absolutely fine. And that may depend on their belief system. I mean, the important thing here is to discuss the diagram in more detail. It's no good just looking at it and making assumptions. So on this one, for example, we can see that this person has put their mum, their partner, their best friend and their dog all very close to them in the first circle. And their ex-husband is further out, as would probably be expected, but also their brother and their dad are not close to them. So this immediately gives us something to explore. Why are these people in the outer circles? What's happened in the relationships? And also, is their dog really as important to them as their mum or their partner? Is their best friend really as important as their mum? It's being able to talk about it and really finding out how the person views their relationship. This is also a useful thing for you to do yourself, because doing it yourself will then help you to do it with volunteers. So it's really useful, and it's a simple and quick way to look at the relationships in a client's life. Now, some people may also put someone in that very inner circle with them. And that's something to discuss, because are they dependent? Do they not feel like a separate individual? again, it needs discussion. So let's move on to look at another really useful tool. So in diagram 2, again, we have me in the center, and the main people that are in our life. So here, this person has got their mum and dad and several other people that might be siblings or best friends. There may be a partner in there. And so what we would do here is we're giving a rating on a scale from 0 to 10. So this allows the client to see what relationships are the most positive and helpful to their well-being and which relationships are not. And then further discussions can take place to look at what's going on there. So, for example, if this person scores a relationship with her mum as a 3 out of 10, but her dad a 9 out of 10, then clearly there's an issue there with her mum, and that can be explored. If she's got multiple friends on here, and some of these get scored lower than a 4 out of 10, then what's going wrong in that? Is it really a good friendship? What's the balance in that friendship? What's the areas of difficulty? So again, it's a very useful and quick diagram to get an indication of the positive and negative relationships in somebody's life. Now we can use that same diagram but in a slightly different way. And this is used for one specific relationship. And that can be with anybody, but we would change the categories. This is based on a relationship with an intimate partner. So it's got sexual satisfaction here and sexual attraction. And obviously, they certainly would be changed if it was a relationship with a friend or a different family member. So here we've got different categories. In this one, we've got emotional support, financial support, career support, how this person supports their self-esteem, how secure they make them feel, shared life goals, shared ideas, shared interests, sexual attraction, and sexual satisfaction. So this is used to see what the person is getting out of the relationship, how supported they feel, how much they still fancy the partner. So they would score each of these categories again from 0 to 10. And it gives a very clear indication of what is wrong in the relationship. For example, if they give sexual attraction and sexual satisfaction both a 9 out of 10, but there was shared ideas and shared interests were only a 2 out of 10, and supporting self-esteem, emotional support were again scored very low, then this would indicate that the relationship was based on the sexual element rather than anything else. And again, it could be totally the other way round, so that the partner was very supportive, but there was no sexual attraction anymore. Maybe there was a very low score for shared life goals because they'd drifted apart and wanted different things. So again, it's very easy for a client to complete this, and then it's about discussing it further about what's going wrong in the relationship and what's going right in the relationship and changes that may need to be made. So it needs to be done in a certain way, because I have had this where I've used it with couples and they've shared their scoring and then had a big argument about the scores they gave each other. So although it can be useful with couples, it's probably best in a way to do it with just one person. And you can't work with couples anyway at the current time. But it really helps the volunteer or client to see the strengths and weaknesses in their relationship, and it helps them gain self-awareness, and it also helps them make decisions about the future. And again, this is useful for you to do yourself as an exercise. Doing it about past relationships can help you understand maybe why they failed, and also doing it on a current relationship, if you're in one, to look at the areas of strengths and weaknesses. And I personally find that clients really enjoy doing these diagrams. They like the visual tools. Let's move on then to look at a couple of different theories on relationships. There's lots and lots of different theories about relationships. How sometimes people can look similar to each other's. We also tend to choose friends that have very similar, a similar outlook on life to us and enjoy the same things. With an intimate partner, some of the theories are that that person reminds us of our mother or our father. Obviously, that's on an unconscious level. That our partner can lack the qualities that we have in ourselves. So we like the opposite. We choose somebody who has maybe got the qualities that we lack. So, for example, somebody might choose a partner who is very outgoing because they're a bit shy and introvert. But that can also be the same reason why the relationship doesn't work, because eventually, if you're shy and quiet and your partner is always outgoing and sociable and wants to do things, it's not natural for you to want to do that. So although those qualities seem appealing at the beginning, often it's the same reason why the relationship doesn't work long term. So researching relationship theories would be very useful to you, as relationships are going to be a recurring theme in therapy. You'll probably see relationship issues when you work with volunteers, and certainly when you start working in placement, clients will be bringing relationship issues. But for now, we're going to look at the social exchange theory and the equity theory. So the social exchange theory proposed a 4-stage model of long-term relationships. And we've got sampling, and this is where we start at the beginning, exploring the costs and rewards of a relationship. So we might watch relationships on the TV to see how they work, and we'll start trying out relationships. And it's basically working out, what do I have to do to get what I want? If I do this, will I get this? And that stage goes on to bargaining. So it involves giving and receiving rewards to see if the relationship will be profitable. How much do I have to give you to get something back? It's that almost game playing that you often say, I'm not going to phone you first, I want you to phone me first. If I phone you on this day, will you phone me next time? If I come to your house, will you come to my house on the next occasion? If I cook dinner for you, what are you going to do for me? So we're working out how the relationship works. And then if we're happy with that, we move into the commitment phase, which is more working on just attending to the relationship. And the last stage is institutionalization, which I think sounds awful, but in this case means settling down with established norms and mutual expectations. And the social exchange theory works on the assumption that we indulge in relationships with the view of getting the best deal. We want rewards and minimal punishment. And we expect a proportional relationship to exist between us. What we put in and what we get out should be equal. And if this doesn't happen, then we might get angry and feel that we're being cheated. And this can be the cause of some relationship breakdowns. And this is called the disruptive justice hypothesis. Let's move on to the equity theory, which is similar in many ways. And it concerns the need for a relationship to be balanced if it's going to be successful. So people will try to maximize reward and minimize unpleasantries in the relationship. The rewards can be shared out in different ways, and the people involved can agree on a fair system. So it's not that everybody has to do an equal amount of everything, but it's agreeing what is a good balance. So, for example, years ago, it was mainly the men that went out to work. They might have worked long hours, but brought home a wage, and men used to be the provider, so pay for things, and also maybe their role was to do the garden and do the DIY. And it was the woman's role to cook and clean, keep the house nice, and look after the children. So if they were both happy with that, then that would be a fair balance. They were both giving and getting, and they were both happy with it. Today, things are often different to that, and a lot of women work. And so if a man was going to work, but came home maybe before his wife, but she was still expected to come in and cook the dinner, do all the housework, and look after the children, then that probably wouldn't be a fair balance. But I mean, here we're only looking at practical elements, and obviously emotional support and all those other things are really important in this as well. And principle 3 was that an inequitable relationship produces personal distress. So when things aren't balanced, one person is definitely not going to be happy with the situation, and it can cause them distress. But actually, it's that person that then tries to restore that balance sometimes by putting extra effort in. And of course, it needs discussion and both people working to make it change. So these theories are really helpful in looking at the costs and rewards and the balance in a relationship. It's also important to look at why a couple were attracted to each other in the first place. and what happened to get them to where they are now. Sometimes we get into a relationship based on attraction or another factor, but we don't actually find out enough about that person. And we maybe go into a relationship too quickly, we move too quickly, and that can also keep problems. We'll give problems. We also need to remember that we need to be authentic. We need to be able to be our true selves within a relationship for it to be successful. And initially, when we meet a partner, for example, or even a friend, we might be on our best behavior and only show the good bits of ourselves because we want people to like us. And we need to remember that the other person may also be doing that. So it's important we're honest with ourselves and with other people that we meet, and we're able to be our true selves within a relationship. So we've looked at some tools and we've looked at some theories, and we can use them in our work with volunteers and later clients. But to help someone, we can also go through a series of stages. These are things we can do to remind ourselves of a way to help a client. So, first of all, who is the relationship with? What is the purpose of the relationship for the client? So, is it an intimate partner? Is it a friend? What is the client getting out of this relationship? And what's the purpose for the other person? What would they miss about that relationship if they didn't have it? What's the balance of the relationship? So, has the balance changed for some reason? And we need to remember that the balance can change when there's a lot of stress in other areas, when one person is ill, maybe when a person has a sexual problem, when there's a loss, bereavement, the balance can change. So we need to look at what the balance is and how and why it's changed, and how can it be rebalanced? How can some balance be brought back there? What are the areas of difficulty? And again, using the diagrams can help us to see that. Is there a pattern in the relationship or type of relationship? So, for example, does this person always end up in abusive relationships, or relationships where she feels she has no control, relationships where it really lowers the self-esteem? Patterns often come from our childhood relationships and how they were experienced. And so we need to look out for patterns in relationship and explore them. I've already addressed how does the balance or equity need to change. And we need to look at, is that change possible? So maybe the balance does need to be addressed, or maybe it's because one person in the relationship is bringing problems in from the past, such as certain patterns in the relationship, certain ways of behaving. And obviously, they need working through. And is it possible to change that for the future? So, is change desirable? Is it possible? Obviously, the person needs to desire that change for it to happen. And in an intimate relationship, really both people need to desire that change. They want to make it work. And of course, we need to deal with the feelings and emotions around that. So somebody may have a lot of sadness because they don't think the relationship can work, or they're not being treated fairly by their partner. They may have a lot of feelings of anger about what their partner's done, or what a friend has done, or what a family member has done. There could be anger about the past if it's to do with a family member. And when we're working with one person, they often want to talk and blame the partner for a lot of things. But it's good to let them offload their feelings, but also we have to look at their behavior, what part their behavior plays in the situation, because we haven't got the other person in front of us. We don't know their feelings. We can only work with our volunteer or client, and what can they do to help change the situation? How can they change the way they're thinking, the way they're behaving, that might then affect the relationship in a positive way? And sometimes, although people come to therapy because they want to make their relationship work, during therapy they will realize that actually it's either not possible, or they're staying in a relationship for the wrong reasons. And their conclusion is that the relationship is going to end. And of course, then we have to deal with those feelings of loss and grief and change, and work with those feelings with that particular person before we end the therapy. So we're supporting them through any changes and coming to a completion. So let's move on now and look a little bit at sexual issues. So, sexual dysfunction. Now, it can be connected with medical conditions, disabilities, medications, sexual trauma, drug and alcohol use, depression, and stress and anxiety. And the Diagnostic Manual of Mental Health diagnoses a number of sexual dysfunctions that fall into these categories. And that's desire disorder, when someone has little or no interest in sexual relations on an ongoing basis. Arousal disorder, when someone is emotionally in the mood, but not physically. Orgasm disorder, when someone is emotionally in the mood, but with an inability to climax, and that can lead to frustration. And pain disorder, experiencing pain during sex. Now, sexual dysfunction prevents someone from enjoying sexual activity, and it can happen at any time and for individuals of all ages, identities, and orientations, but the chances do increase with age. And none of these are considered a dysfunction or a disorder unless it happens regularly and significantly affects the individual's enjoyment. Now, working with sexual issues, there's a lot of ethical considerations here. First of all, we need to make sure that any sexual issue we're working with is a psychological problem. Sometimes people do have physical issues, and everybody should be referred, anyone with physical symptoms should be referred to their GP if they haven't already seen their GP, to rule out anything physical. It could be something related to an illness or disability or a medication, and actually it can't be changed. It's a physical issue that therapy wouldn't help. Yes, we can look at the loss and grief about that, because obviously losing that sexual element of a relationship leads to a grief reaction, and we can work through that in therapy. But we can't actually diagnose any sexual dysfunction, and we need to refer to a GP to rule out any actual physical problem. So we can only work with issues that have a psychological basis. We really need to be comfortable as well talking about sexual issues. A lot of the volunteers coming to us, later on clients that come to us, can often be embarrassed talking about sexual issues. They won't know what words to use. They can find it anxiety provoking. And so it doesn't help if we're also feeling anxious about using those words, if we're not comfortable discussing sexual issues. So that's also important. And beliefs about sex are deep rooted. And it could be something from way back in the past that is still affecting a client. It's important to look at beliefs around sex. And lots of things can cause these psychological reaction, such as impotence. That could happen because a person's partner had an affair, for example, and that makes them feel impotent, less like a man, not good enough. And then that affects them sexually. So there can be a wide range of issues that are causing that problem, and quite a lot to explore in therapy. And so it's important, if you're not totally comfortable to deal with those issues, to be able to refer on to someone else. And also, it's important to only work within your own competence level. And again, if you don't feel competent and confident to work with the issue that a client brings, then it needs to be referred on to someone more experienced. Clients with sexual issues may present with fear. There might be fear of rejection, of responsibility, of being vulnerable, of losing control, and any internalized moral issues. If somebody has got no desire for sex, or always wants someone they can't have, maybe there's a fear of commitment there, or needing more than one lover, then again we need to look at that. And often previous abuse can lead us into dysfunctional relationships. Previously repressed abuse can come to expression through present relationship breakdowns. And in that case, we need to make sure we have the skills to deal with this, or we need to refer it on. Again, at this stage of your training, you can't work with issues of abuse. Sexual abuse can lead to a lot of issues in a relationship, a lot of sexual problems, and they obviously need to be worked through with someone very experienced. Now, you can't currently work with couples. It's quite a complex and challenging area to work in. But often couples do want to come together to therapy, and it's very useful because then you have got both parties in front of you and get a fuller understanding of what's going wrong in the relationship. However, as I said, it is very complex and very challenging. And if you did want to do this, you would need to have more specialist training in that field. But let's just look at some of the challenges involved, because this might help you decide whether it's a field you would want to go on and study after you'd qualified. So both parties must be committed to therapy. It's very difficult if one person is reluctant to attend or has already really made their mind up that it's not going to work. And I often get phone calls from one party saying, oh yes, we need couples therapy. My partner doesn't really want to come, but I've told him he must. Now, if that person really doesn't want to be there, it's not going to work. There must be a required goal. And is that goal suitable for couples therapy? Now, if one person is bringing an issue from the past into the relationship, or there's a pattern that person always carries into relationships, then it's probably not suitable for couples therapy. It's being able to do the work with the individual. And later on, when that issue is resolved, then couples therapy might be able to help them move forward. Are you a therapist or a mediator? And do you as a therapist feel you can remain impartial to both sides? Now, it's very difficult because clients often have arguments in the therapy room, and sometimes it can be difficult to control the session. And it's also very difficult to be impartial. There may be a situation where you can definitely empathize with one person, but not the other. Do you feel able to cope with a potentially volatile situation? And sometimes couples do get very angry, even to the point of aggression. And it's sometimes difficult to calm that situation down. Both parties must feel safe with a therapist. And you, as the therapist, you need to be non-judgmental, give both people equal attention. And again, it's not always easy. And a couple, a male and female couple coming to see a female therapist, then the male might feel in the minority and feel like there's going to be more judgment on him than his partner. as I said earlier, the problem needs to involve both parties. If it's an issue that one person is bringing, then it really needs for that person to have individual counselling. Obviously, getting to know two people takes longer than getting to know one. And so it's working slightly differently. We need to balance the necessary history taking with finding out about the present problem. We can't try and get a good timeline on both people. It's very time consuming. So it's getting the balance right. And another really important thing is that we need to practice all our communication and active listening skills, because there's two people sitting in front of us, and we need to pay equal attention to both. We need to observe two lots of body language. We need to have really good active listening skills to hear what each person is saying and also what they're not saying. And that is not, it's not easy. So these are just some of the challenges of couples counselling. It can be very rewarding, but specialist skills are definitely needed here. So when we're working with relationships, the true value of the work is often in the relationship between the therapist and the client. And when you start working with volunteers and later in your placements with clients, you will notice some of these different types of relationship that you can see. So Clarkson came up with these 5 relationship types. And these are relationships that can be found between the client and the therapist. And some of these are more likely when we're working with certain models of therapy. However, they can all be seen at different times in the process of therapy with a client, depending on the client's issues, at the stage of therapy that we're at, and how the therapist is working. So we've got the working alliance, and this is really the part of the relationships that enables the client and therapist to work together, even if the client isn't fully committed to it. And we can see this in CBT therapy, where maybe there isn't always the core conditions present as much, but we can still form a working alliance with somebody. And also doing the contract and assessment can help build that working alliance with somebody. And the transference and counter-transference relationship, and this is where the experience of unconscious wishes and fears are transferred onto the therapeutic relationship. So, for example, the therapist reminds a client of their mother, who maybe they're angry with, and the client reacts towards the therapist as though they're that mother that they're angry with. And the idea here is that the therapist picks up on that and discusses that further with the client. And so we're more likely to see this when we're doing psychodynamic work, although it can come out at any time. The reparative or developmentally needed relationship is where the therapist really provides that corrective or reparative or replenishing relationship that the client didn't get as a child. So maybe their parenting was deficient or abusive or even overprotective. And so having that sort of relationship in the therapy room where the therapist is showing them positive regard and valuing them can really help to repair. And so we can often see this in a person-centered approach where we're offering those core conditions of congruence, empathy, and unconditional positive regard. And the person-to-person relationship, this is the core relationship, as opposed to an object relationship. We're seeing the client as a real person. And again, that can be seen more in a humanistic approach. And the transpersonal relationship is difficult to explain. It's almost like a spiritual connection, a healing relationship where maybe that connection between the therapist and the client is on a deeper level. And so within the pluralistic approach, when we're using different models and tools of therapy, we might see these different relationships at any time. So all types of relationship can be present in all approaches. And it's just being aware of these and recognizing them and recognizing what we're actually doing in that relationship with our volunteer or our client and how the relationship is progressing and changing. Now, one thing that we need to remember when thinking about ethics is that our relationship with our volunteer or our client is very different to our relationship with a friend. So it's just thinking about boundaries and dual relationships. When we're with our friends or family members, we talk about a lot of different things. Sometimes when we're listening, we're not always giving full attention. We might be thinking of what we want to say next. We might share a lot of personal information about ourselves and chat openly about things. And we might always expect our friend or our family member to be there when we want to talk. We'll also often give advice and tell our friend what we'd do in that situation. And they might give us advice. And obviously, when we're counselling, those things are not appropriate. We will be talking about lots of things, but we'll be talking about the client's issues, what the client wants to talk about. The client will share a lot of personal information with us, but we won't be sharing a lot of personal information with them. Self-disclosure is a very important consideration. Sometimes it is useful to disclose something about yourself if it's going to be helpful to the client and make them feel more comfortable. But as I said, it's important to really think about that and whether it's appropriate. We're not going to be discussing anything about our client except with our supervisor. We need to have very clear boundaries as well as to when we're available to talk to our client. And we also won't be giving them advice or telling them what we would do in that situation. So it's really important that we recognize the differences here and we have clear boundaries. And dual relationships, we cannot be a counselor to our friends and we can't have those dual relationships. So if we've seen somebody for counselling, then they shouldn't become our friends. So it's making sure we don't cross over. Okay, so let's just review what we've covered. So we've discussed the social exchange theory and the equity theory. We've looked at ways of helping clients, the process that we have to go through, and we've looked at various visual tools that can really help our clients and open up good discussion. We've discussed sexual issues and ethical considerations around that. And we've taken a brief look at couples counselling just to give you an understanding of some of the challenges there. And we've looked at the importance of the therapeutic relationship itself. So relationship issues are often the cause or at the core of many other presenting problems, such as stress, anxiety, depression, low self-esteem, addictions, self-harm, anger. So it's a very important area. And in the majority of cases with volunteers or clients, you will be discussing relationships. Now, the client's present is where we start. So person-centered therapy, offering those core conditions, will be used to help build that rapport and that trust, allowing the client to tell their story. We need to get an understanding of the person. We need to be able to empathize with what they're going through and offer that unconditional positive regard so that they trust us to open up and trust us with their personal information. And then we can start looking at some of the theories that might assist, such as the social exchange or the equity theory. We can discuss where their current relationship started, how it's changed, maybe the costs and rewards have changed, maybe goals for the future have changed. So we can look at the tools to look at the positives and negatives of relationships and see what needs to change. Now, psychodynamic work will always be important with relationships because the past, in most instances, dictate the way that a person conducts future relationships. And we've talked about the importance of looking for patterns in relationships. We need to look at early attachments and whether they were secure or insecure and how that's affected a person as they've gone through life in terms of their relationships. And the client's future is what they're there to improve. And so it's looking at any negative thinking, and CBT will also be useful here what changes need to be made for the future to be better. And of course, we then may need to work through endings of a relationship and also the ending of therapy, which can be difficult for people. So that's it really from me today. Hopefully you've got a lot out of this lecture, and you'll probably have more questions that you want to take to class to discuss with your tutor, and you'll be able to put some of the techniques into practice when you do your practical work in class. So let me just stop sharing. And I'm going to say cheerio for now. Thanks for listening.